What's up, everyone? My name is Dr. Chad Shafer, administrator of the group. I help people move and live better with less discomfort and pain. But this video is not really about me. I wanted to go live on here. I think this is the first time I've done this, and just share some ideas and some things to help you guys out as far as some issues that you're dealing with. A little caveat to every video we try to do is none of the information proceed in this video should be viewed as medical advice. But with that being said, let's get into some content. So I want to tell two success stories, and I want to talk about some kind of scientific concepts in rehab and just how you can start to understand how to overcome either neck, TMJ, jaw pain, headaches, whatever the case is. Because I kind of silently listen to a lot of people, and I interact with other people as well and try to answer questions for you guys. But I want to kind of hone down on some stuff and give you some answers, or at least some concepts into why you've either failed treatment in the past or why you're still dealing with problems. So I want to tell one success story to start off the bat. So a patient that I saw a little while ago, I think this was really cool because this was a person that had thumb numbness for a very long time. I wrote a blog and an article about this. I thought it was really cool because she actually came for neck problems, but she was in the clinic for thumb issues, and she had, what's going on, Deb? She had some thumb issues, and she wore like this little thumb hat. I've never seen that before, and so she wore that because it made her thumb feel better, like she could actually feel it. And she had had this for, I think it was 10 years. It was a chronic issue. She'd been to multiple specialists, multiple physical therapists, and she just couldn't figure it out what the problem was. She wasn't here for that, but eventually we decided to check it out. And, you know, the next time that she came in for her follow-up visit, she actually mentioned that it was changing. So this is not like a miraculous story where, oh, you're going to be 100% better in 1 second. Like, that's not what it's about. It's about making a change. So for someone's symptoms that you've had for 10 years to be able to change is fantastic. That's really cool. So again, if you're somebody that has quote unquote chronic symptoms, or even if it just happened yesterday, chronic symptoms are really just something that you haven't figured out yet. So just don't label yourself as I am this, I'm a back pain patient, or I'm a TMJ patient. Well, that's not really true. You're a person that's dealing with problems. So it's a really great success story. So I wanted to start with that. So let's talk about, I got a couple things on the list here. This is going to be probably somewhere under 10 minutes total. The first thing I want to talk about is, this is some research that we looked at. This was Medicare data, so it is actually about lumbar spine surgery, but it does relate to neck, jaw, headache, as far as the concept that it brings out in relation to if you should have conservative care, you should have surgery, or what should you do. So this Medicare data actually said, what are the 3 things that predispose you to surgery? I did an awesome quiz this weekend because I'm a big nerd, and I asked my wife and my friends and family. I was like, hey, fun fact, what do you think the 3 biggest things are predictive of lumbar spine surgery? Because someone they knew just had a fusion in the lumbar spine, and they were like, well, pain levels, weakness, comorbidities, diabetes, all sorts of things that you would think would actually predispose you to having surgery. And after I sat and listened for like 5 or 6 minutes, I said, no, the only thing you guys got right was age. So the 3 things that came about this study was, this is going to blow your mind. So age is one of them. Obviously, as we age, doesn't mean that you're going to crumble and fall apart, but that does play a role in if you may or may not have surgery. The other was zip code. Pretty astonishing. So meaning, usually the people that live in the quote-unquote wealthier areas, or whatever the case is associated with zip codes, are more likely to have fusions, because fusions honestly reimburse a lot more than a hip or a knee replacement. The other thing was insurance type. Again, kind of blows your mind, meaning only one of those things has anything to do with you, your function, what you're dealing with. So again, 3 things: age, zip code, and insurance type. That blows my mind. I always try to bring that up to patients if they're considering surgery. Outside of red flags things where they really need to see a surgeon, those 3 things should not be the top things, the top tier things that say that you need a surgery. And again, this is Medicare data. This is, I think it was 2003 or 2002. So it's a bit outdated. I know when I did this course, they talked about why it's so outdated. It's because Medicare is kind of slow. It takes them time to come up with good data like that. So just keep that in mind. Let's roll on to the next topic. So I wrote some things down if you see me looking back and forth. The one thing I wanted to mention is if you're in this group and you're seeing people talking to each other, you see me talking, you see other members talking about certain things, and oftentimes people ask, like, I've got this symptom here, my SCM on the right hurts, or my left, temple muscle hurts, or whatever the case is. Oftentimes, us as human beings, we're looking for a quick fix. That's why medications are so popular and honestly so accessible as a business, because it's oftentimes a quick fix. You take it, bam, headache's gone, bam, my back feels better, I don't have to do anything about it. So how this relates to, if you guys are asking questions as far as what can I do for this, there's oftentimes that only one thing is not going to be your solution. Meaning, if you've got a headache and someone says, hey, do this exercise, do a chin tuck motion, do a stretch to your trap. If I have somebody over here that's say, Mary, and I've got Bob over here, and I give them the exact same thing, over time, those people are going to fail. One person is going to fail along the line, and the other person is going to succeed. They're not all going to succeed and feel better. So don't just look for one solution. Oftentimes, pain is complex, and you need to look at a different approach and actually move the whole body and assess what the problem is. So again, if you're looking for one solution, that one thing that somebody may give you might help a little bit. It might even make it worse. So just keep that in mind. That's the next point. So pain is complex. I talked about that. I'm not going to talk about that again, but pain, I'm going to share a quick example of a personal story of my own, but pain is complex. A lot of the times it's musculoskeletal, it's mechanical, meaning people like physical therapists, PM&R doctors, regular physicians, chiropractors, stuff like that. We can help you, but a lot of this is our whole life. There's a lot of research that says stuff like satisfaction with life, satisfaction with your job, your relationships, your spouse, how you feel on a day-to-day basis. Do you have a lot of self-esteem? Those all those things, depression, socioeconomic status, all of those things play into what your symptoms are having. Even Deb mentioned on here, so thank you for that. So what happened was this, pain is a lot more complex than just one and two. There's a lot of things that are going on here. So let's talk about. Just one thing is often a simple suggestion. So what I just talked about, if you're looking for one solution, I always relate it to, there was a commercial a long time ago about a vitamin set that had a picture of a middle-aged to older age person that was talking about perfect health, and it was like, if you did one push-up or you took one drink of water, like, what if you could just achieve all your goals if that's all it took? That's the same thing if you're asking somebody else for just one solution or one stretch, one muscle for your jaw, whatever the case is. So again, it's more complex. So I want to share this story about myself because I think it's important, and it brings about why neck pain and orofacial problems are oftentimes mechanical, but sometimes they can be a pain in the behind and a lot more complex. So I titled an email, and I think a blog about this, about why my last job gave me neck pain, and honestly why I decided to move forward and get out of that position. And I didn't even realize it until someone mentioned it to me. So I was having some pretty gnarly base of the skull pain for almost every single week, and I didn't have it on the weekend. I didn't really put two and two together. The clinic that I was at didn't really afford me the time to kind of self-reflect and feel, what am I feeling? Am my neck stiff? Is this, what kind of stressors am I going through? And it was interesting because every time I drove to work, my neck just hurt, and I was trying to do all sorts of cool PT stuff and even had somebody work on me, and just nothing helped. It was very, very, the relief was very, very short-lived. As soon as I stopped working at this place, gone. Neck pain completely gone. That type of neck pain was completely gone. So it really kind of inspired me to write some information to people suffering with these things, that you really need to look at your whole life as overall well-being. That means things like meditation, self-reflection, breathing exercises, things like yoga. Just getting you moving is the best thing for you, but also stress in your life plays a big role in any type of pain, especially orofacial neck pain. This is our center of the universe, where if this hurts, life just kind of sucks. So let's talk next about, we're just going to go through some topics. I'm near towards the end. I want to talk about what a spasm is, because I hear a lot of people, my patients included, people on the group, a lot of people talk about a spasm. And if I, as a provider, actually ask my patients, well, what are you describing when you talk about a spasm? Because there's a lot of nomenclature that's being thrown around. What is a spasm? What is not a spasm? So a lot of people describe a spasm as a sensation. They really mean a sensation of tightness, My lights went out. A sensation of tightness, they mean pain, they mean uncomfortableness, that means that they can't move well, all sorts of different adjectives to describe what they're feeling. But what they're usually not describing is a true spasm. A true spasm when it comes to the muscle function is a tectonic state of muscle contraction where you literally, the muscle on and off, where it's just constantly contracting. So that's a true spasm. And it's important to know the difference because most people don't actually have spasms. They've got pain and movement restrictions and issues they're dealing with, but it's usually not a spasm. Sometimes it's this may or may not make a difference in your everyday life, but it's important to differentiate when it comes to possible treatment or what you're dealing with as a patient or as a person. So let's talk about why the neck and the jaw is related. And then I want to talk about why the low back, the lumbar spine, and the legs are related, or the hip joints. And this is this exact same concept I want to talk about. So this is a concept we term regional interdependence, meaning like, let's take the neck, for example, because this is a neck, jaw pain, headache group. If the neck's not moving well, or your brain or nervous system senses some sort of a threat and it locks down your neck motion and your jaw motion, makes everything really, really tight, it's going to start to lock down adjacent joints to that area, meaning if this joint's not moving, this joint's going to suffer as a result because it's all connected. Same thing in the lower lumbar spine or the lower back and the hips and the knees. Oftentimes I see people that are just hammering home at knee exercise, hip exercises for people and patients and just not finding the results that they're looking for because they haven't what we call like looking at the lumbar spine or the neck. So that's why the neck and the jaw is related. There's a couple more concepts why they're related, but it's just that one affects the other. I think we all know about it, but we don't often implement it, whether you're just a patient looking for answers and the person that you've worked with hasn't gone down that path. Just bring it up to them if you're working with someone. Say, hey, what about my neck? Let's exhaust the heck out of my neck and see if it makes a change in my symptoms and go from there. So this is a couple concepts in kind of pain science and research. There's one called cross-excitation. It's just a fancy word meaning like if you've got one pain in one area, it'll tend to kind of jump around to the other adjacent and close by neurons, and it'll actually make them hyper-excitable. And you don't want your nerves to be hyper-excitable. You want them to be normally excitable. All right, we're still here. Sorry about that. So you want your nerves to be normally excitable, meaning they have a certain threshold for pain or symptoms or whatever you're experiencing. And if you're hyper-excitable, that means that the smallest thing is going to set you off, meaning you have a threshold or a box of function, and your box starts to get smaller and smaller and smaller, meaning that you can do less and less and less. And any little movement or twitch or motion or just talking to somebody can set you off. You don't want that. You want your nerves to be happy, and they want to hang out with you and just move and have a good time. So that's kind of the basics of cross-excitation. I mean, there's tons more complex information about it. Some of it's boring, some of it's really cool as far as the literature, but we're going to move on from there. We talked about the hyper-excitable state a little bit, regional independence. The one thing that I use a lot with my patients, because people love analogies, I use the power plant analogy, meaning if we talk about regional interdependence between the neck and the jaw, the lower back and the hip, I use the power plant. So I say, okay, you're in a neighborhood, say I live here in Michigan where I'm at, say all the houses on my street go out, no power, you have a brownout maybe. Is it more likely that your house is the problem, or is the power plant and the demands that are on the power plant that's giving the problems in your houses or in your businesses? That's a good analogy I use for especially people that have bilateral symptoms, bilateral upper trap, bilateral hip problems. It's probably coming from somewhere that has a common origin, like your neck or your lower back. So going from there, that's a good analogy I love to use. So let's talk about, let's see what we got. I want to talk about a little bit of interactions in the group. And if you guys have suggestions, please feel free to hop on or let me know in the replay. I want you guys to respect each other's interactions. You guys do a great job. Heed each other's experiences and draw off that. But don't take the information that we all think the internet is fact. Don't take that to heart, because there's actually some research that looks about looks at the more and more information we consume as consumers, especially with the internet. At a drop of a hat, we can find out what E equals MC squared or anything we really want to, or jump on YouTube and learn some cool exercise real quick, or learn the conversion rate in half a second. There's some research that's coming out that's actually saying the more quote unquote informed you are, the worse that you're going to do. And specifically, this research was pointing towards lumbar surgery and lumbar fusions, like I talked about in the beginning of this, but it relates to neck and jaw and facial pain, because the more and more people say, oh man, it could be this super rare condition, or you probably have this going on and it's very, very terrible, and your neck is degenerating, you're going to fall apart tomorrow. Like, those things just make you scared. You don't want to move, you don't want to lift, you don't want to live to the fullest extent because you're scared your disc is going to blow across the street. Like, those things are just simply not true. You're just somebody that's having pain, you're having restrictions, your quality of life is suffering. It doesn't mean that you're going to die tomorrow, you're going to fall apart. So just heed that information, a little bit of warning, meaning like the more that you consume from people and different opinions, it may actually make you worse because you're more concerned about certain things. So I want to end with a quick success story, and then I'll wrap it up from there. So this is a patient that I recently saw. I think I posted the video in the group. It was a young mother that was having some neck and some shoulder problems, and honestly, from a provider standpoint, she was a really tough patient to work with, not from a compliance standpoint, meaning she wasn't doing her exercise or following up. She just presented very intermittently. She fell off a chair after 6 visits when she was like 90% of the way there, so it was like, man, it's just a bummer. And she just kind of fluctuated in how her symptoms were behaving. It wasn't very consistent. But we got to a point where they were consistent. We diminished her arm pain, got it very, very localized, got out of her shoulder towards her neck, and then it was about 98% of the way there. And at that point, we said, all right, let's discharge you. Here's an awesome program. This is what to do on week 2 after you're done. This is what to do on week 6. Move forward. You'll do great. So that's an awesome success story. So what she said, she could start to lift her kid. She could lift her arm overhead. She did a lot of shift for work as a part-time mother, so she could get back to that. Like, those are really cool things that are real-life examples of what you can get back to, instead of just consuming negative information about what things you should be scared of. You should look forward to the things that you can get back to. And I usually talk about, I actually learned this, I forgot who it was from, but the concept of thinking from the inside out, or meaning pick a goal, pick something that you want to do, and then write it down, put it on your smartphone, or whatever you want to do, get a cool whiteboard, and then build your steps backwards on how you're going to get to that point. So say my goal is to, let's use like a financial goal. I want to make like $200,000 a year. All right, well, let's back it up from there. What do I need to do? Do I need to be satisfied with my job in order to put that amount of time in to make that amount of money? Okay, why do I even want to do that? To provide for my family so we can have, a nice life. I'm going to have 100 kids, whatever, help the community out, give back, what I want to do from there. So it's just building from the inside out. So that example is definitely not just financial. It's life satisfaction. It's satisfaction in relationships. It's really the why behind why you do things. So that was just a really cool success story. Again, so my parting words to you guys: don't give up. Keep striving, keep moving, and don't let negative thoughts, perceptions, and information that you find on the internet bog you down, because this stuff gets better every single day. With that, have a good night.